Ontario NDP Leader Andrea Horwath paid a visit to Thunder Bay today.
She spoke about healthcare needs in the north at the Lakehead Nurse Practitioner-led clinic on Archibald Street. This as the Ford government announced more than $750,000 in funding for that same clinic. Lee Noonan has more.
I'm pleased that by visiting communities it helps shake some money out of the government. That's a positive thing.
The funding will allow the nurse practitioner-led clinic to hire 2 nurse practitioners, 2 support staff, and 2 receptionists, increasing their patient capacity by 1,600 up to 5,800. Also, presumably, shortening the long wait times for new patients.
How long is the wait, for?
2 years.
Oh, is that right?
Yeah.
Executive Director Pam Delgatti explains that clinics such as theirs serve an important role in providing primary care to patients who might otherwise not receive the care they need, which can increase the strain on the rest of the healthcare system.
And when people don't have access to this, they go to somewhere like the emergency because they need their medication. And in doing so, it's tying up resources and it's preventing people that do need emergency services from getting it. So we have to make sure that this is something that is available for all people.
Horwath was in the city to announce her party's plan to deal with a shortage of healthcare providers in Northern Ontario, which they will be putting forward next week. She also spoke about reforming the Northern Travel Grant, getting rid of salary caps for healthcare workers, and increasing efforts to hire and retain medical professionals in Northern communities.
Making sure that there's housing available, so housing that's adequate and appropriate for healthcare providers to be able to live in smaller communities, live in northern communities, live in rural communities, but also there are other pieces as well. Working with communities to ensure, for example, that there are employment opportunities for other members of family, particularly spouses. As we know, people are not going to relocate to a community that doesn't have educational standards in terms of the number and availability of schools for kids.
Horwath also emphasized the importance of using resources already in place in Northern Ontario, including retaining healthcare professionals who are already in the region and increasing the number of spaces at the Northern Ontario School of Medicine.
Without a solid plan, we're going to continue to see what we've seen for decades here in Northern Ontario, which is, as we've already talked about, lack of access, lack of health professionals across the spectrum, and people not getting the health care they deserve.
Lee Noonan, TBT News.